Thank you so much, Dr. Howe, for being here. Dr. Howe is an internal medicine specialist here at Midcoast Parkview Health, and we're grateful that he's here to talk with us about how to think well, right? Because we all have brains, but we don't always use them. All right? And sometimes we use them and they don't work like we'd like them to. And so thank you for sharing with us.
Oh, you're welcome. Eat well to think well is sort of the topic that I was given. Some people get cancer, others have heart disease. The thing we all fear is our memories failing us, and some of us here are experiencing that. And the good news about if that includes you, then you won't have to worry about what I say tonight because you won't remember it. But some of it may. As you age, the brain normally enlarges. Did you know that? Normally, your brain enlarges because you add new brain cells or make new connections every time you make a new memory. And so the brain is designed to grow as we age. We didn't used to think so. We thought that, you know, when you hit about 20 or 25, that was it. But there's some memories you've made since you were 20, right? Quite a few of them. And sometimes we, we see a person, we know them really well, and we just say, now what was their name? Well, that's not really a memory problem because it comes back to you. It's a filing problem. But you think about how many people you know now versus how many you knew when you were 25. A lot more is stored up there. But your brain should enlarge. However, if the circulation is impaired in your brain, or if you have other problems, the brain tends to not enlarge but shrink. And I see CT scans and MRIs of the brain in my patients quite frequently, and the radiologist will say, normal brain shrinkage for age. No, that's not normal. It happens, but we'd like not to have it happen, and there are some steps that we can take so that we maintain that cognitive function and aren't losing brain cells. Because every time you lose a brain cell, you lose a memory. If you lose a connection, you lose a memory. Our brains are sort of like a road system. And if I ask you to go to Freeport from here to pick up something for us all to eat, which way would you go? 95. Well, you get halfway there and 95's closed. Now how are you going to get there? There's still other ways. You could take Highway 1. Well, bridge is out. Another way? Yeah, there are lots of ways you could get there. And the same is true with our thoughts. If you lose a cell, you can go around the neural network and complete the thought. But if I said, well, I want you to go to Freeport, and you got on your way and there were, 6 of the 7 ways knocked out, you might say, oh, what's the use? And forget what you were going for anyway. And you've met people, you might be one, that you're thinking along and then you say, where was I? What did I, and that's a sign neural networks are knocked out. And we'd rather not have that happen. The brain shrinks or atrophies primarily through lack of blood flow. If you want good brains, you need good blood flow. I have a quote there, perfect health depends upon perfect circulation. That's not from a scientific article. You'll notice that there's some quotes in each one of these that are from a lady that wrote on health. She was born in Gorham and spent some time in Topsom. Her name was Ellen White, a good Maine woman. And she wrote some interesting things, and I thought I'd just throw them in for fun. But it's true, perfect health depends upon perfect circulation. If you want good brain, you want to save your white matter and your gray matter, you better have good circulation. Anything you can do to improve your circulation will improve the number of cells you have. They'll last longer. You want that. So instead of first off on diet, I'm going to start with exercise. One of my favorite studies demonstrated that there is a direct correlation between the size of the muscle in your thigh and the size of your brain. So if you got some nice big thighs, you got it up there, provided that it's muscle, not just FAT in your thigh, right? I really like that study. So we need to walk. If you want a big brain, get out and walk, or climb stairs, or get on an elliptical, or a rowing machine, or something to exercise. And it's not just thigh muscles, it's muscles in general. The more active we are, the stronger we are, the more blood we pump around our muscles, the bigger our brains are. I mean, don't worry if your thighs get really, really big from muscle, your brain's not going to burst out of your head. But, and the muscle doesn't burst out of your leg either. But you do save brain cells. And so the more activity you do, the better your brain function's going to be. Really, really important. And as we age, that's harder to do that exercise. I was recently seeing one of my patients, and they said to me, these are not the golden years. They were in their 80s. They said, these are the diamond years. Everyone gets harder. And it is harder to exercise, but it's, you know, my own feel is every gym ought to be filled with people over 65. You know, if they're 40, what do they need the gym for? Well, you do need the gym at 40, but it's even more important as you age to be exercising. Even in the young, vigorous exercise improves mental strength and clarity. How many of you have read the book Spark? Anyone read that book? Yeah, it's a great book. And what John Ratty, who's a psychiatrist down at Harvard, found is that you can improve the mental function in kids with exercise. There was a school system in Illinois. You have something here? No? School system in Illinois that was, their achievement test score was the lowest in the state and some of the lowest in the country. And somebody got the bright idea, we're going to make these kids exercise. So they had them exercise for 10 to 15 minutes at the beginning of every class. They had to get up and do, you know, exercise. You know what happened to their achievement scores? They went up. They went to the highest in the state just from exercising. So that's even in the young, yes.
So I just, in here it says vigorous, I see it a couple of times. What about gentle? Like if people are a little frail, gentle it would be a good place to?
Any movement is good. The more vigorous, when you get your heart rate up and you get a little winded, then you're pumping blood really well. And the more exercise you do, the better. To a point, I mean, you don't have to run a marathon to keep your brain, but it wouldn't hurt to walk. Studies by Dean and Aisha Sherzai, who wrote the book The Alzheimer's Solution, showed that if you really want to protect brain function, you should exercise not X minutes a day all in one session, but break it up throughout the day. And they recommend at least 10 minutes an hour. Now, housework counts, gardening counts, but you want to do things with dispatch and with vigor. You know, you want to be breathing a little bit hard, and for some of us that means walking across the room and we're breathing a little hard. Others of us have to, you know, really push it. I'm breathing hard just looking at my son run now. I used to outrun him, but no longer. He'll go for a 100-mile run before he stops. I don't do that. I'm still jogging because I want to preserve my brain function. But walking is plenty good. Just when you come to a hill, speed up, going uphill. And you go, and you really breathe hard, that's good. You think, yep, my brain's going to be working. So exercise is really important, and as I put there, for maximum brain function and preservation, exercise should be taken throughout the day with a goal of 60 to 120 minutes. That's 10 minutes an hour if you're up 12 hours, right? So get with it, keep moving. And that's gardening, like I said, that's, it's walking around, but try to get some vigorous exercise in there as well. And then a quote from that good Maine woman: not only will the organs of the body be strengthened by exercise, but the mind also will acquire strength and knowledge through the action of these organs, the muscles and whatnot. And it's true. I mean, it just makes good sense. If you want to have good blood flow to your brain, use your muscles. When you're walking, your legs pump almost as much blood as your heart does, just through the contraction of the muscles. So that's your second heart, if you will. That's why the thigh muscles, as they get larger, it helps preserve the brain. All right, there's exercise. Now we're going to look at sugar. Is sugar good for your brain or bad? Bad. Gotcha. It's what your brain runs on. You got to have sugar to work your brain, unless you go into a fasting state. Then you can burn fats in ketone form. If you go into ketosis, you can burn that. But your brain doesn't like it. As long as there's a drop of sugar anywhere, it'll burn that. You got to have sugar for your brain. The problem is if you get too much. It's just like your car. I've talked about that before. Or your lawnmower. Anybody worked on lawnmower engines? Those old things with carburetors, and you got to adjust it just so your air and fuel mixture is right. If you get too rich a mixture, it runs rough and smokes and doesn't have any power, and you can't mow your grass. And the same is true with your body. You need the right fuel mixture. Problem is, most of us get too much sugar, and then we get trouble. And so what's the effect of excess sugar on the circulation and bodily function? It's terrible, right? Diabetics know this because they go in and get their hemoglobin A1C measured. That's an average of what your blood sugar is. But as I've mentioned many times, when you glycate, that's attached sugar, to a protein, hemoglobin, you stiffen the protein, and now you've sludged the circulation, because those hemoglobin, that's in red cells that are 7 to 8 microns in diameter, and they have to flow through capillaries that are 3 to 4 microns in diameter. And if you stiffen that red cell, you can't push it through there. When I was in medical school, they had a really neat video. They injected sugar into a hamster in their vein, and then they did a video of blood flowing through the veins and arterioles and capillaries in the hamster's pouch. You could stretch that little pouch over the microscope, and injected the sugar, and within just a few minutes that blood flow slowed down. And then they injected a little more sugar, and it just about stopped. It went instead of racing through the cells. Because it's hard to push a stiff 8 micron red cell through a stiff capillary, and glycation does that. And it does, because after your last Thanksgiving dinner, what did you feel like? Sluggish, right? Why did you feel sluggish? Because you couldn't get blood to your brain anymore. Part of it is you pulled it to the stomach, but you felt sleepy and like you'd like a nice long nap. And so you were on your way to dementia after that meal. And so what you need to do this Thanksgiving is let's all go for a good hike and get the blood flowing really well, and then don't overeat. Eat enough but not excessively. You can make a wonderful apple crisp without any added sugar. I did for our church the last weekend. No added sugar. And everybody ate it and came back for seconds. So you can do it. It just takes a little work, and you cook the apples a little better, and that works well. So you want to cut the sugars down to maximize mental function and preserve neurons. You minimize refined carbohydrates and eat a high fiber diet. Why high fiber? Because fiber slows the absorption of the sugar into the blood. And that's what you want for mental function. Diabetes increases the risk for dementia, no question about that, but you don't need diabetes for that to happen. You can just eat too much sugar. And that's too bad, because I really like that. In the 1800s, that Maine woman wrote, "Sugar clogs the system. It hinders the working of the living machine." You couldn't have chosen a better phrase than "sugar clogs the system." If you get high sugar levels in the blood, that's exactly what happens. It clogs the system. Let's move on to fats and mental clarity. I've talked about fats in this lots of times. But again, we're talking about blood flow here. Consumption of cholesterol, that's from animal products. There's no cholesterol in plants. And saturated fat, which is found both in animals and in plants. That raises cholesterol and increases the risk for atherosclerosis. Atherosclerosis impairs blood flow and raises the risk not only for heart attack and stroke, but also for dementia. And you just don't want that to happen. So we want to minimize our intake of cholesterol and saturated fat. And palm oil and coconut oil are saturated fats. We need some saturated fat. We get some in nuts and other things, but you get excessive amounts in palm and coconut oil. I was looking at some peanut butter that one of my office workers brought in. I thought, well, maybe I'd like a little peanut butter on a piece of bread. And what's the ingredient? Peanuts. Second one, palm oil. And the third one was sugar. And the fourth one was salt. But I thought, I think I'll just skip that. And you guessed the brand, right? When I said, I think I'll just skip that. So just if you're going to have peanut butter, just have those, you know, that peanuts and a little salt, and you're going to have a lot better blood flow to your brain, because you've eliminated that palm oil, which can cause problems. Now that's atherosclerosis, and that's buildup of cholesterol in the arteries and inflammation that comes from it. But there's another process called flow-mediated dilation, and flow-mediated dilation is essential for brain function. If I had a nice picture up here, or Christine, come up here for a minute. Turn around, and I want everyone to look at her sweatshirt. It's a really nice one there. Okay, turn right around. Now look at that sweatshirt really closely. Now as you're looking at that, you know what's happening to the blood flow in your brain? It's markedly increasing to the occipital lobes. Okay, you can sit down again. That's where we see back here. And your blood flow, as you're looking at a picture intently, to blood flow to the occipital lobes can go up by 2 to 3-fold if you have flow-mediated dilation. And if you're doing a math problem, same thing can happen. The blood flow to the frontal lobes, where we do mathematics, can go up by 2 to 3 or 4-fold. But if you've just had a really fatty meal with a lot of oil in it, you lose the ability to dilate those arteries well, and then you can't think as clearly. And they've done studies both with sugar and high-fat meals and shown that if you give someone math problems, their ability to do them slows down just from inability to get blood flow where you need it. And that's an acute problem, but over time, if you lose flow-mediated dilation long enough, you're not getting enough blood flow there, you lose blood cells. And so you want to avoid that. And that happens with all oils. There's a study I quoted there from Nutrition, Metabolism, Cardiovascular Disease in 2007, January, palm oil, olive oil, and soybean oil all impair postprandial flow-mediated dilation. So you don't want that to happen, so you're going to minimize that intake of oil. Can you still use oil? Sure you can. All you have to do is exercise at 70% of your predicted maximum for an hour before you eat, and then it doesn't happen. You're able to maintain that. So, you know, let's go jogging for an hour, right?
What kind of oils do you like?
The kind that are in the nuts or in the olives, just the whole thing. The whole thing. You know, when I first, my wife and I went on an oil-free diet, and we're still on one unless we're out visiting and someone gives us something. I don't say I'm not going to eat that. I just eat it. But at home, the only oil we have is for the car and the lawnmower. And at first when I did that, I thought, I've gone to Auschwitz, you know, because I didn't know how to cook. But if you use whole nuts, you don't have that problem, or olives or avocado. And there are good studies that show that. I quoted one, I listed one there. Flow-mediated dilation was impaired after a meal with olive oil, but not after a meal with the equivalent amount of fat from walnuts. The fat's in a different form, it's combined with antioxidants there, it's handled differently, and you don't lose flow-mediated dilation. So learning to, I had waffles for Sunday breakfast, and when I first went on this kind of a diet, I thought no more waffles, because, you know, I'd add a half a cup of olive oil to those waffles. And then I thought, well, how about nuts? And so, or seeds. And so what I did this time is I used some peanuts, and I used sunflower seeds. But I often use walnuts or cashews or one of those, and you just put it in the blender and blend it up, and then it doesn't stick to the waffle iron, and you get a better product. And here's how I know it's a better product. How many of you, let's say I've got a tablespoon of oil in this hand, and I have a handful of nuts in this hand. Which do you want to eat? The nuts, right? Why? Tastes better, right? Yeah, and the food tastes better when you learn to cook that way too. When my kids were away at college when we first went on this kooky diet, and when they came home, they said, we don't know what you've done to the food, but it tastes better. And, you know, I don't want to live longer if it doesn't taste good, right? So you have to learn to cook again to do this, but I think it's worth it. I mean, I want to keep my brain and all my other organs functioning well. And so that's what we do now. Interestingly, my wife and I went to a conference about 6 weeks ago now, and we ate their food. And as we left for the weekend, it was all vegetarian, vegan. When we left, we said, how do you feel? She said, I feel really heavy. That food, you just, if you're used to, you know, running on high test and you go back to diesel, doesn't work so well. Yeah. And that's what you find. You feel a lot lighter and more energetic if you retain your flow-mediated dilation.
So for all your recipes that call for oil, what Dr. Howe just said, using the nut or using the olives, just putting that in your blender, you can use that for all of your recipes. I haven't found one yet that you can't use that for. Regardless of the genre of food, you can do that.
Yeah, it's lots of fun, and I like to maintain flow-mediated dilation. It's very fun to try that, but it was hard at first when we made the transition, because it's so much easier just to measure out the oil and dump it in. What we do instead of pie crust is we make, that apple crisp I was telling you about, I just took, pecans, and I just threw them in my food processor and turned them into little tiny pieces, and I mixed it with rolled oats and a little bit of salt, and that was the topping for the pie crust. And it worked. People ate it. I didn't get to bring any home, that was the only problem. Did you have some, Cheryl? Was it okay? All right, good. All right, I'll pay you later. So that's fats. And again, a little quote there from Councils on Diet and Food written in the 1800s. Eat regularly and eat only food that is free from grease. You know, that's a good rule of thumb. Over 100 years ago written. All right, inflammation and mental clarity. Everything we eat is stored or burned by our bodies. Burning calories causes inflammation. Everything you eat has to be burned or stored, right? And when you burn something, that causes inflammation. Unless it's packed with antioxidants. Now, I wish I could tell you, you can eat anything you want, just take a pill and it'll fix it up, if it's but it doesn't work. And in fact, lots of studies have shown if you take a pill containing antioxidants, it just doesn't prevent inflammation like getting them in the food itself. You need to have the antioxidants on site while the fire is going to prevent the inflammation. Antioxidants are like firemen or fire extinguishers, and they run around with the food and prevent inflammation. And so we want to eat foods that are high in antioxidants. And how many antioxidants are in meat, milk, eggs, cheese, fish, chicken, and turkey? None. None. So if you're going to eat those, you better eat a lot of blueberries with them, right? Or something else that's colorful. Why colorful? Because the antioxidants follow color in every plant food except one, and that's the alliums, and that's garlic and shallots and onions. They have antioxidants that aren't colorful, but are very, very potent. So I'm really glad that Cheryl eats a ice cube tray of garlic every 2 weeks, mixed with her food, right? You know, you don't have to keep it in the ice tray. My wife's gotten into this, and she gets those ice cube trays that are silicone, fills it up, and then when it freezes it, she pops them out into a plastic bag, and that works really well too, and you can put a lot more in it. She does that with ginger as well and other things, so it's lots of fun. So if you want to reduce inflammation, and inflammation underlies all chronic disease, whether it's cancer or heart disease or dementia, it all plays into that. Circulation and inflammation underlies all the problems that we're talking about. And if you want to reduce that, eat the rainbow. You know, your plate needs to be colorful. Those red peppers and those green peas and that corn, that's what are rich in antioxidants. And it'll help preserve your brain and your heart and everything else. You know, you're finding that it's the same answers for every problem, right? Same diet cures most things. And same bad diet makes most things worse, too. All right. I thought I'd just take a minute and shift away from that into mental diet. Did you know that the thoughts you think change the very structure of the brain you think them with? Now think about that. Well, you're changing your brain as you think it. It's really fascinating. And I've quoted this study before, I know, but string players that, you know, do this, the part of the brain that controls the left hand in string players is much more highly developed than the average person. That you can look on a brain scan and see it. It's much more highly developed because they're doing stuff with their hand and it develops their brain. The thoughts that you think, the things that you do change the very structure of the brain that you think those things with. So it's really important what you think, right? And there's a fascinating study just published in May, June of this year, showing that there's a direct correlation between gratitude and preservation of cognitive function. Because the people that were really grateful and happy, there were several other studies I didn't put in here that my wife and I were just going over before I came over. I was a little late because we were having such a good time on the phone with these studies. But it helps preserve the amygdala. In fact, in people that had higher gratitude levels, the amygdala was much bigger, and the amygdala is involved in memory and emotions. And you know which memories are the most imprinted into your brain? Emotional memories, right? And that's a good thing, because you know, when we're talking about family and, you know, you want those grateful memories about family anyway, seared into that brain or imprinted strongly into the brain. But how do you become grateful? You choose it, right? You choose it. It's so important for us to choose what we think about. And sometimes we think, well, my brain just automatically generates thoughts. Well, it does, but you choose what you're going to dwell on. I think of a patient that I had. She died at 98 years of age, and she was still mentally very intact. She had other problems than dementia. But if you ask anybody that knew her about her life, they'd say she had a really hard life. But if you ask her, she'd say, I've had the best life. I have so much to be thankful for. And then she'd start telling you stories. And I could tell you stories about her that would really make you laugh. I mean, she was just lots of fun, and you wanted to spend time with her. And she finally became disabled enough physically, she had to be in the nursing home. You know what? She found a friend of hers that was in there that had memory problems, and she started spending time with her and telling her stories, and her friend's memory improved as she started laughing more. The staff was amazed at how this woman woke up and started interacting and was eating better and getting all from input from this lady. So it's really important, if you want to save your brain, to practice choosing your thoughts. Thought control is so very, very important. And there are quite a few studies on that, but I really like this one that just came out. And a quote there just for fun: "Nothing tends more to promote health of body and soul than does a spirit of gratitude and praise. It's a positive duty to resist melancholy, discontented thoughts and feelings." You know, why is it a positive duty? Because it'll save your brain. And that's worth a lot. You know, there's an awful lot in this world that is not great to think about. And you say, well, I want to stay in touch with the news. And anybody read any of Thoreau's writings? Yeah, Walden Pond, you read that? He has a really neat section in there about the news. He says people want to read the news and stay up on the news, and then he says it's all the same, and he makes a list of the latest news, and it sounds like yesterday's paper. And that was written in the 1800s. And when I read that, I just thought, you know, that's really fascinating. And here's the other thing. Is there any new news? No, it's not new. As soon as it's reported, it's old, it's past. And there's so much bad going on. I had a patient in today. He says, I feel so much better. I said, why? He said, I stopped watching the news. And not that we don't want to be informed. We do. But let's not focus on that. Let's focus on doing what we can to make our situation around us and for our friends better. Yes, Vic?
I remember right after 9/11, they stopped all commercials, they stopped all programming, and they were just covering what happened at the World Trade Center. Well, after about 5 or 6 days, they started putting shrinks on TV, and they were telling people, turn off the TV. Stop watching it. And I was surprised, because you figure the channels, they want people to watch TV. But they had professionals telling people, because they were getting a high increase of people really getting distressed.
Right.
And coming into their offices all rattled because of what happened. There's only so much about 9/11 you could watch on TV, but they were actually telling people,
Turn it off.
TV.
Yeah. It's so fascinating, you know, the thoughts that what we focus on for our mental diet affects our mood to a large degree. And exercise, of course, is very helpful for depression. I mentioned it's good for preventing dementia, but it also has been shown, studies in Duke University showed that regular vigorous exercise is more effective at treating depression than medication. Why? It improves brain function, blood flow, and interestingly, a lot of times we have difficulty telling the difference between depression and dementia because the signs and symptoms are almost identical. So just choosing your thoughts and staying fit, you improve depression levels and you help reduce dementia, and it keeps your mental clarity much better. Question?
How do you deal with curiosity or too much curiosity?
Well, I don't think you can be too curious unless you're curious about things you shouldn't be. Or, you know, negative things. Curiosity is really, really important. And it's what, I mean, we want to be continually learning. Remember, if you learn a new thing and remember it, you've made a new connection or a new brain cell. And I don't mind if I lose a few as long as I'm making more, right? And we're all going to lose some. I mean, if you get head trauma, you're going to lose some brain cells from that. If you have a stroke, you're going to lose some brain cells. But you can make new ones with decided effort. And that's really, really important to keep in mind. Keep working your brain. We talk about physical exercise. Mental exercise is really important. How many of you use GPS to find your way? Okay? How many of you can still read a map? But not everyone. I have kids that I deal with. I can't read a map. They don't know how to. And they can't find their way. It used to be, and you can confirm this, I'd look at a map and then I'd put it down and I'd have it in my head. And I'd just drive there. And now you get on GPS and you follow it to your destination, and then you have to turn around and follow it home because you weren't paying attention. You were just listening to that thing instead of using your brain. And they've shown that the area in the brain that reads maps is much less developed in the new generation than it was in our generation. Just that thing. You know, so use your brain. Another one is calculators. They're wonderful. My mother was a bookkeeper, and she had a gentleman come into her office one day. He was there on business, and he said, "I'll bet you I can add a column of figures, four digits, faster in my head than you can on your adding machine." And she said, "Okay, let's test it." And so they each had a column of 10 figures. He could add them faster in his head than she could on her adding machine. Why? Because he had exercised his brain to do it. And I find, you know, it's so easy. I got my calculator on my cell phone now. And so you think, well, I could do that in my head. No. And then you think, you lazy bum. You should have done that in your head. And, you know, when I was in college, all my friends had calculators. I used a slide rule. Anybody use slide rules? Yeah. And I used one all the way till medical school. And then I thought, oh, I might as well get a calculator. I don't want to I wish I'd never gotten a calculator, because the slide rule, you have to think, right? And they're kind of slick too, and they don't need batteries. But keep your brain active and exercise it. Be careful what you think about. Choose your thoughts really carefully. If a thought flies into your head, that doesn't mean you need to dwell on it. You can say, not that one. I'm going to choose and actively choose to think about something else. And it really does help preserve your brain. Any questions? Well, yes.
Just to go back a bit to the nut health, what's the equivalent of nuts to?
Oh, that's a harder thing. Cheryl, what's the equivalent of nuts to oil?
It depends on what you're using it for. So like when I do waffles or pancakes or something of that nature, I usually do 1 for 1. So if it calls for, you know, 1/4 of a cup of oil, I'll use a handful of nuts, which for me, I've measured it as a 1/4 of a cup of nuts. For other kinds of cooking, like something that I'm sautéing or whatever, I usually use a smaller amount. So for sautéing and that sort of thing, or you know, cooking on top of your stove, I will usually use water instead of oil. But there are some things that I do want a more of an oily base, and that's when I will whiz up a can of olives, usually green olives, and I'll just keep that in my fridge. And so when I want, you know, something oily on the bottom of my pan, then I'll just pull out a tablespoon or so of that. And it's just to keep your onions and garlic from sticking.
Yeah. And vegetable broth works really well. It'll give a really nice flavor. Yes.
Tell us about vitamins and supplements. Are they, any of them value, and which ones could be?
I don't usually recommend supplementing, except if you're on a strict plant-based diet. I do recommend you either have your B12 level measured or you take a B12 supplement. It takes about 30 years to become B12 deficient if you have 0 intake and a normal level when you start, but there are a group of people that don't reabsorb B12. The B12 is circulated in the gut, and if you don't reabsorb it, you can become deficient, and B12 deficiency is serious. The other supplement is vitamin D. Vitamin D is not a vitamin, it's a hormone. Your own body makes it when your skin is exposed to sunlight. But we don't get enough sunlight from now and through February. Even if you go out in the sun, you're not going to make vitamin D. And so I do recommend that you supplement vitamin D through the winter months. We hear a lot about vitamin D and bone density. Review those studies. There's not good evidence that vitamin D prevents osteoporosis. It is important for muscle function and immune system function and other things. We've created a vitamin D deficiency society by talking about how precious our skin is and how we don't want to have any skin cancers. Interestingly, if you're on a lower fat diet, even if you get lots of sun, you won't get as much skin cancer. And the problem comes not just with sun exposure, but with sunburns. That's where you get into trouble. The other interesting thing is people that have skin cancer generally have less internal cancers, probably from sunshine. And one more thing about sunshine, the best part about sunshine is its warmth, right? Because that's near infrared rays which markedly reduce inflammation. And you can get that all winter long if you just sit inside your house and the sun's streaming in. Warmth from the sun, even through your glass, is near infrared rays. And that increases melatonin levels in the mitochondria. That's the stove of the cell, and that's where burning takes place. Melatonin is a potent antioxidant, so you get more sun, you have less inflammation, you also have lower blood pressure if you get adequate sunshine, and that's near infrared. It goes right through your clothes. When you go outside like today, it was a brisk wind. I went for a walk at noon, and it was cool, but I could feel the warmth of the sun. I said to my nurse practitioner, well, we're getting near infrared rays, and sure enough we were, because you could feel the warmth. One of the reasons that we think COVID was so bad in this country is people don't get enough sunshine. And if you don't get enough sunshine, your melatonin intracellularly, not in the brain, but well, there too, but in the mitochondria, made during the day, your levels are low and you're much more susceptible to high levels of inflammation, which was what went wrong with COVID. So get your sunshine. Vitamin D supplementation did not help COVID. It was just a marker for sunshine exposure, and so there was some, people were recommending mega doses of vitamin D. It didn't help, but sunshine does. So that was a long explanation for a short question. Sorry. Yeah. All right, well, thank you very much.
Thank you.